Hi, I'm Rick Dancer. We're here with Dr. Monticelli, a medical oncologist with the Willamette Valley Cancer Institute. And I'm excited to talk with you, and I think a lot of guys will be excited to hear this, and their wives, just because when prostate cancer is treated and then PSAs start to come back, you're the doctor that we're probably going to go see.
Yes, that's right. I'm a medical oncologist, and I and several of my partners really focus in on treating patients with prostate cancer. In the scenario you describe with a PSA that's rising after definitive therapies such as surgery or radiation, we call that biochemical failure.
Okay.
And most of those patients in that scenario will have a rising PSA and no other evidence of disease. And the good news about that is you don't have to do, in most cases, you don't have to treat it right away.
Because I think most of us think, I need to get in there and get this done and get this treated. I do need to get in and talk with you,
Right.
but then have some expert advice and get some opinions.
Yeah. So in a patient whose PSA is rising, we'll initially do some scans, a bone scan and a CAT scan, to see if the cancer has spread into the bone or any other organs.
Is that the first place it usually goes, if it's going to
Yes,
spread?
the vast majority of times it'll go to bone first, and the other spot where you see it is in the lymph nodes in the abdomen. And that, when the PSA is rising after surgery, it's pretty uncommon to find that. Most patients, it's just, like I said, the biochemical failure and a rise in the PSA. And the good news there is that if it's moving slowly, you don't have to treat it right away. And we define slowly as a doubling time in the PSA in excess of 6 months. And so we'll track serial PSAs, and we do scans, periodic scans over time to see how fast things are moving. And most men want to avoid the side effects of some of the hormonal therapy, so it's nice if you can continue just to observe things. And I don't like to use the phrase sit back and watch, because that
Right.
denotes sort of a passive approach. This is, I think active surveillance is a very accurate term, because you're really looking at precise points in time to see if things are changing.
Is that sometimes hard to get across to men because we are fixers and we just want to
Yes.
go in and fix this thing,
Right.
and I want to get it taken care of, when sometimes just expert advice and sitting back
Is the best approach.
is a fixing process.
That's right. So if I look back over the past year, most of the patients I've seen, we sit back and we're just checking PSAs every 2 to 3 months, and then I extend that interval over time. And you really have to understand the patient and their willingness to wait. Some patients are much more worried about the cancer and want to act on a PSA sooner. And others, you'd be surprised at how high some people will let their PSA go before they really want to intervene. So you really have to individualize to the patient as well.
So the first step would be, if somebody says, okay, we need to get moving because it keeps going up, and is Lupron hormone therapy, is that?
Typically the first intervention we would do is Lupron, and that's a drug that lowers testosterone levels because the cancer typically feeds on testosterone. And that's usually highly effective. And lowers a PSA and controls the cancer quickly. And again, somebody with a rapidly rising PSA is somebody where we'd probably advise that they go on Lupron.
And there are the side effects are...
There are some side effects, unfortunately, and so you can gain some weight, you lose muscle mass, you can have hot flashes. It's sort of the male menopause. And like I said, a lot of men want to avoid that if they can.
But you can do it on intermittent scales too, so it's not just like forever.
That's correct. The data tells us that continuous Lupron is slightly better than intermittent Lupron, but the side effects are more significant, and it's really better to individualize.
New drugs, new treatments, new things that are coming out. A lot of hope.
There is. This is an exciting time to be an oncologist because the understanding of cancer has advanced so much. And the treatments are much more focused on the specific abnormalities. So some of the newer hormonal medicines are more specific in the enzymes that they target.
Does that mean fewer side effects?
That means fewer side effects and more effective treatment. And then there's other medicines that have been developed, such as Provenge, and that's something we would use for somebody who has metastatic disease. And then there's some other molecular drugs that target specific proteins that the cancer relies on to grow. So it's a lot of things in the pipeline, very encouraging time to take care of these patients.
So actual chemotherapy comes pretty late in the process for most people. I mean, if you find a mass, then you might be right into chemotherapy, but for most
Rarely. Even if we find a mass, there's usually other things we would try first. The Good thing is that we're giving less and less chemotherapy as time goes on. It's still out there, but that's the last option, and we've built in a multitude of other options before we get to that point.
So what do you say to men? Because I remember being there when you are in this place where you think, I just need some information. I need to know what to do, and there's nobody really there to tell you what to do. At the Willamette Valley Cancer Institute, you have a team of people who come together and really work with men,
Right.
to give them that hope, and you don't have to panic. You don't have to, get too nervous about this.
Right. So I always tell patients, get information and get opinions. And we're very open here to second opinions. We work a lot with some of the academic institutions in the Northwest. And before you make a decision, it's good to get several opinions on what to do, because there's so many options. And it's becoming so individualized that it's hard to say there is a standard approach for everybody. That's wrong. So get the information and get some opinions, and we can help you do that.
So the gold standards that we used to have are no longer golden. There's too much gold out there now.
That's right, yes.
Thank you so much. This has been helpful for me too. I think this will be really helpful for guys. So if you need more information, go to the website for the Willamette Valley Cancer Institute. It's right here on your screen. We have all sorts of information for you. And thanks for being here and talking.
All
to
right,
folks.
my pleasure.